I'm Tom Brokaw. Tonight, it's the new frontier of medicine reversing the effects of heart attacks. Also, crooks, con artists, and bungling bureaucrats taking your money. But all this week, they're exposed on the fleecing of America tonight on NBC Nightly News. The war on terror. These prisoners being held since the war in Afghanistan. How the U.S. Supreme Court will now weigh in on their continuing imprisonment. Dialing for dollars. House Republicans offering leadership awards. But there's a catch. Campaign contributions. Lifeline. Repairing a damaged heart after a heart attack. Science fiction coming closer to reality. And the fleecing of America. The fight over a new bridge. Is it a road to opportunity or a wasteful way to pave over paradise?
From NBC News World Headquarters in New York, this is NBC Nightly News with Tom Brokaw.
In a moment, big news for anyone with a cell phone and Lifeline. A major breakthrough for heart attack patients. How doctors are bringing damaged hearts back to life. Now to Lifeline. Remember that old hit song from the 70s that posed the question, how can you mend a broken heart? Well, tonight there may be a new scientific answer, a way to mend or rebuild heart problems that afflict millions of Americans. This exciting prospect was presented today at a meeting of the American Heart Association. NBC's chief science correspondent, Robert Bazell, has details tonight.
More than 1 million Americans suffer heart attacks every year, and many end up like Sam Cohen, a dentist who had 3 in a row.
You lose the feeling of invincibility when you have heart problems.
Cohen was so weak he needed a temporary pump in his heart to stay alive. Nowadays, people often survive heart attacks, but end up with badly damaged heart muscle that can leave them very weak. At least 3 million Americans have permanently damaged hearts. Doctors at the Arizona Heart Institute suggested Cohen try an experimental procedure, implanting cells in his heart to repair the muscle damage.
It is bringing science fiction closer to reality.
Here's how it works. Heart attacks cut off so much blood supply that there is often a visible area of dead tissue. To fix it, doctors first remove muscle cells from the thigh. These cells then multiply in a lab dish for several weeks. Finally, the doctors transplant the cells into the damaged heart area with a simple injection, and they become new heart muscle. So far, 27 patients in the U.S. have gotten the procedure. Researchers are also trying the technique with cells from the bone marrow that can grow into muscle.
So today we'll be doing 3 injections.
Some researchers have tried the experiment only when they were doing open heart surgery for other reasons. Others are putting in cells through tubes in the vein called catheters.
The chances are very good that this will be a therapy in the near future.
In Sam Cohen's case, a test called a PET scan shows in the red areas much of his heart muscle has come back to life. Doctors will need to do many more cases to prove the procedure works.
Good try, good.
But Cohen says he hasn't felt this strong in years. Robert Bazell, NBC News, New York.
That's Nightly News for this Monday night. I'm Tom Brokaw. I'll see you back here tomorrow night.
And we are joined now by Dr. Nabil Deeb, who we just saw in Robert Bazell's spot. And Dr. Deeb is Director of Cardiovascular Research at the Arizona Heart Institute and helped develop this new procedure. He's with us tonight from Orlando. Dr. Deeb, welcome.
Good evening.
You said in that piece, the near future. What do you mean by that?
Well, right now we have completed a safety trial consisted of 27 patients with a 2 years follow-up. The safety results appear to be very encouraging and will allow us to proceed with a larger trial to test the efficacy of the cell transplantation on heart function.
A year, 2 years, 5?
We are expecting in the next year to proceed with multi-center clinical trials.
So you still think it's several years away?
Will be my expectation will be 3 to 4 years for this therapy to be available.
Tell us what happens here, and why do they use the thigh muscle?
the skeletal muscle, compared to the cardiac muscle, repair itself after injury. And the reason it repair itself because an existing cells called myoplast, a cell exists in the skeletal muscle. The idea is to move these cells to the heart attack area to repair the damaged heart. We can't take those cells from any other skeletal muscle in the body.
So based on what you've seen in these studies, when you inject the cells into the heart, how long does it take to repair?
Those cells fuse and form myofiber in about 2 months to 3 months. And in 3 months, you see evidence of a new life in the area of the heart where the cell were transplanted.
This is amazing research. Give me some idea what the ramifications are for other parts of the body.
Right now, we are working very extensively in the heart. But as you know, there's cell transplantation for many other organs, such as the pancreas and in the pancreas to treat diabetes. And that's another very, very important area for the near future.
Something for the future. Dr. Deeb, it's good to speak with you. Thank you very much for being with us tonight.
Very welcome. Thank you.